what advice would you give to clinical providers wanting to give their patients the latest cutting edge in developments in the longevity space, bound by those rigorous standards on evidence and research? Like, where would we direct our patients, or what would you even tell them?
You stay bound to rigorous evidence-based stuff. As mentioned, there's things in the longevity ecosystem that the people shouldn't try, right? The stem cell therapies that Sergey mentioned earlier, and things that may not have full evidence, and you don't necessarily have a team of experts on the ready to go just to intervene or anything like that. I think for physicians, if they're bound by evidence-based work, they should continue to work in that space. But I encourage people to take more self-responsibility or action to do preventative check-ins. So just kind of zoning in on that. But I would definitely say that for me, when I go to my doctor, I assume that when I ask them about something, they're getting the most up-to-date information about a specific topic that they are able to validate for me. So when I bring up questions about, oh, have you heard of this study, or what do you think about this process or this protocol, the response I typically get is, I haven't read enough papers of enough data to confirm that that's a real effect. And so I can't advise you on whether or not that should be taken. And I think is a reasonable approach, because there's things change super quickly. Someone does one study, then another study comes out, then another study comes out, but it's someone's health, and we want to make sure we preserve and protect that.
My take would be so as an HCP, well, embrace longevity, data-backed longevity medicine, right? So there is the whole part now, which is called longevity medicine, which is based on preventative and personalized approaches. We actually helped create it's a Swiss-based, the biggest society, so yes, an association of longevity physicians, which is called Healthy Longevity Medicine Society, HLMS. They do have their certain protocols and certain interventions actually certified, for example, with NHS in the UK. So right now, it's the biggest official, the most credible kind of society of longevity physicians that are working with data-backed approaches, right? Where the focus is exactly on preventative, on personalized to a certain degree. So if you are an HCP, you have a ton of educational resource that is available out there without, as Artem mentioned, kind of diving deep into these snake oil type of treatments. Yeah, embrace longevity medicine kind of as a framework of thought in a way, and you will naturally segue into prevention versus sick care. There is no other way.